Namaste and greetings. I, Ishika Chaudhary, researcher at IMPRI, Impact and Policy Research Institute, Prabhav एवं नीति अनुसंधान संस्थान नई दिल्ली, extend my warm welcome to you all to IMPRI #Web Policy Talk. Today, we have gathered for a panel discussion on the topic Urban Sanitation and Gender Concerns as a part of the series The State of Gender Equality #Gender Gaps by IMPRI. Chair for the session is Professor Vibhuti Patel. She is visiting professor at IMPRI, New Delhi, and former professor at Tata Institute of Social Sciences, TISS, Mumbai. We welcome you, ma'am.
Thank you, madam.
With the permission of the chair, I would like to introduce the distinguished panelists.
Yes, Ishika, please introduce the distinguished panelists. Yeah.
As panelists, we have Anand Jagtap. He is retired officer on special duty Slum Sanitation Program, Solid Waste Management Department at Municipal Corporation of Greater Mumbai. We welcome you, sir. Next, we have Meena Kamble. She is president of Swachhata Sanvardhan Mahasangh in Mumbai. We welcome you, ma'am. Dr. Sujata Khandekar. She is founding director of CORO India, Mumbai. We welcome you, ma'am. And next we have Supriya Jan. She is program manager, Right to P campaign, CORO India. Due to unfortunate circumstances, she is not able to join. And next we have
Dr. Sujata Khandekar is not able to join. Supriya is with us.
Okay,
yeah.
Right, ma'am.
Yeah.
And next we have Vijayshree Pednekar. She is co-founder of the Urban Project Mumbai. She's an architect and urban planner too. We welcome you, ma'am. We all look forward to learning from the esteemed gathering. Now I hand over the proceedings to Vibhuti, ma'am.
Thank you, Ishika. First of all, I would like to thank Dr. Arjun Kumar and IMPRI team for providing us this platform to discuss a most mind-boggling issue that is urban sanitation, and especially the gender concerns, because it's the women who are at the bottom of the pyramid of whole solid and liquid waste management. So this deliberation, we are going to have our panelists as Dr. Anand Jagtap, Dr. Supriya Jan, Ms. Vijayshree Pednekar, Srimati Meena Kamble, and Dr. Sujata Khandekar was all set to join us, but because of COVID and infection, she has not been able to join. And the esteemed participants who are interested in such a non-glamorous issue like sanitation, and that too from the gender angle. So we all know that in the urban areas, due to huge infrastructure gap, women and girls face innumerable security risks and other dangers when they use toilets shared with men. Safety and privacy are women's main concern for sanitation. With lack of safe sanitation, women's dignity, safety, and health are at risk. Majority of urban Indian population lacks access to improved sanitation facilities. Population growth in the urban India is far outpacing the increase in access to sanitation facilities. As a result, more than 50% of India's healthcare burden is associated with the lack of access to safe drinking water, inadequate sanitation, and poor hygiene. So many vector-borne diseases that we are getting, they are linked to this. And that results in a massive morbidity among the population. Poor sanitation facilities in the home force women and girls to use unsecured locations outside the home, putting their safety at risk. Limited access to sanitation facilities in schools negatively impact school retention rates of girls, including their progression up to school ladder following puberty. Innumerable studies done by gender experts in different states of India have found massive increase in girls' school attendance whenever like the safe toilets are provided. So it is very important, and the water, when the water was available in less than 15 minutes away compared to more than half an hour away. So because of the responsibility that the girls have of fetching water. Lack of sanitation reduces the ability of poor people to improve their livelihoods. Adults are prevented from working effectively. There is detrimental effect on children's learning. Adequate sanitation facilities positively impact economic and educational productivity of women and girls and their personal safety and dignity. Poor water and sanitation facilities are also attributed to aggravating epidemics such as diarrhea, cholera, malaria, dengue, chikungunya, and pandemic caused by Zika virus or coronavirus and Ebola virus that we have seen in several parts of the world, including in our country. In the urban slums, settlements are overcrowded and have limited water and sanitation facilities, including low water quality, unreliable supply, and unsanitary storage, that all of which lead to unhygienic conditions and rapid and uncontrollable spread of disease. A study on gender dimension of recent COVID-19 pandemic found that non-availability of water in the homes and distance to water points had implications for women and girls whose role is to fetch water. During the quarantine period, women and girls had to find means to get water and had to regularly face manipulation and sexual exploitation from the bullies who were stationed to ensure they did not leave their home, their houses because of the imposition of by